Good. There's some tension here too. Look up for me. There we go.
It's really tight.
Yes.
It's like really deep in there. Like kind of on this side of the muscle.
Good. I love it.
Yeah.
I'm gonna bend the leg here. There we go. You feel how sore it is back here.
Yeah.
We're way off there.
It's not as tender, actually.
So that's probably the most tender point of all. Oh, you are a little ticklish. Uh-oh. There's no tight muscles at all. So that right there.
Unlock your full potential at CrackAddictz.
Hey guys, it's Dr. Matt from Lifespring Chiropractic in Austin, Texas. We're here today again with Natasha. She may look familiar. We saw her before previously for some shoulder tightness and shoulder tension, but something new came up and I figured it would be worth showing. So what'd you do? What happened?
I was stretching and I heard this pop and crack in my like hamstring area, and my the pull, the tension just went loose and I fell over and I was like, what's this thing?
So this just happened today, yes?
Yeah, and then I called him and I was like, hey, I think I broke my leg.
So let's have you point to even where you felt it. So it's while doing
right
yoga
here.
And right on the back of the hamstring. But you felt a pop.
Yeah.
So what I told her previously was that when we hear a pop, it's usually not actually a muscle, it's coming from the joint somewhere. So that muscle, the hamstring, attaches up at the hip bone and down at the knee. So I'm thinking it was one of those two things, but we're gonna do an assessment so we can figure out what's going on with that, where it's coming from. But we're gonna start actually with just some light motion first, because I wanna see how you're moving now after that. Just reach forward first. So pain with that on the hamstring?
A little bit, but not much.
Okay, and then how about just leaning backwards? So we're looking.
Yeah, like right here, but it's not, it's like really deep in there, you know?
Okay, so right here, for your nerds out there, what we're doing is we're moving through the pelvis. Seeing how the pelvis moves, when she leaned forward is actually where we see most of that abnormal movement come in. But let's see a side bend to each side now. So sliding your hand down your leg, good. And then to the other side. Does that agitate it to either side there? Okay, good. Let's have you lie on your back, please. So face up. So before we look at her spine, we're doing things different today because of what she's specifically done to the leg. And I just want to feel that normal motion first of that knee, and then also some of the motion of the hip as well, internal and external rotation of that femur, we call it. I'm thinking just from kind of seeing her move a little bit, to me it's looking like it's coming from more of this. And I'm actually going to palpate here the trochanter. Yeah.
Yeah.
Tenderness right
that.
there. Yeah, me too. So, and more so right in the middle, right there. Mm-hmm. So more than on the front, and more than on the back end of that, right there.
Yeah.
So I'm palpating the greater trochanter for anyone that's nerdy out there watching this. So now we're gonna.
Yes.
So internal and external, and that even more so is not moving. So feeling for internal and external rotation of the hip. That's where it really gets stuck, or that's where it really doesn't want to move. So just from that, in my mind, I'm definitely thinking more so it's coming from that hip, and then we're gonna feel that front to back glide of the knee. That feels fine, and then a side to side too. So anytime we hear something, if it is a pop, I'm just checking worst case scenario, structure of her knee for that structural integrity, making sure you didn't pop any kind of ligament or have any kind of tear in the knee. You have not. Yeah, and this should not feel painful at all to you. Definitely from feeling motion and just from doing a couple slight things, it is that hip. So that pop, even though you didn't feel like it was coming from your hip, it was. So let's have you go face down, please. So turn over, and we're gonna do some analysis more with the pelvis on the SI joint, so the sacroiliac joints. So looking at the leg length, we're way off there, Natasha.
It's really bad.
Your right leg It's significantly shorter than the left.
Wasn't it the other way around?
Yeah.
What's happening?
So probably just something that she did to her pelvis when she was doing yoga. And yeah, that,
I feel that.
Immediately, me too.
Yeah.
And on that, so more on the right side, yeah.
Mm-hmm.
And that right one was the one that was way short. And even though on the front end it was the left hip, you feel how sore it is back here on the right. So the problem is not always even where we perceive we feel something. It can be something connected or something close. And then I want to muscle test the hamstrings also. Okay. The hamstrings neurologically are controlled through here, the lower lumbar. So from talking to our nerds out there watching the video, so let's test again the one that you didn't feel anything to. So that, and I want you to kick toward your head like that, okay? Go ahead. Okay, and I'm giving good resistance there, and you've got good strength. Natasha, you feel how that feels good? Now one more time with this, push toward your head. And not as good. It's not horrible though. That's not even really that worst one. We're gonna do a couple more because I'm thinking more so just that pelvis is where we really need to address. So I would expect with feeling your pelvis and seeing the leg length here that her glute muscles are really disengaged more than anything. So let's have you hold this out here. I'm gonna push in, don't let me, and nothing there. So exactly what we're feeling is. And you feel, Natasha, did that feel weak to you?
Yes, super weak.
Okay, and we'll check the other side for reference. Hold there. So much better. I can't move it. Now let's check the other glute, the glute max, the big mover here. I'm gonna push the leg down, don't let me. Okay, not horrible. Let's check this one. Same thing, hold here, don't let me push it down. I said don't. I know. Feel it's harder, right?
Yeah.
So we're gonna make an adjustment to that right hip first there. So let's have you on your side with that right side up, and then I'm gonna bend the top leg. There you go. You know the drill. And I'm gonna roll her whole body toward me, soften there, soften. Good. And then let's have you go face down one more time. We're gonna retest a couple things and we're gonna see if that feels different to you also. So first thing that we looked at, and even how she laid on the table was different. It's straighter, which is good. And then the leg length there, we're back to even. That was a huge change. Yeah, and that's not poking out so much, and that probably feels different. How does it feel compared to where it did?
Less tender, and there's no pain.
Good, that's what we want. So then as we retest these muscles here, with the nerves from the pelvis control, we should see better activation. So on that right side was where we were finding the weak ones. So hold here, Natasha. I'm gonna push in, don't let me. Hold. Okay, there. One more time, hold. There, good. That's what we want. Kind of bring this up. I'm gonna push down, don't let me. Good. And then let's check the hamstring on this opposite side even. So kick toward your head. Hey, I like it. Better. So seeing those muscles turn back on, that's good. So before we even do anything else there, I want to have you stand and I want you to we're going to run through that motion again and see if that feels different even. So now, again, just reaching forward.
Yeah. I feel like pain here though.
So on the hamstring still.
Yeah, but that's probably a muscle, right?
Yeah, so muscle attaches to bone, and we went to that origin of where the hamstring starts. So we're still going to evaluate, but one more time with the extension also. So it back, so you move better.
Yeah.
Through both
mobility,
of those. Yes.
Range.
So that's first thing, but now I am going to actually feel that muscle where you're feeling it. So let's have you lie face down for me one more time. So I'm going to palpate that muscle from origin to insertion, and really that center point is where I'm going to start, where she's feeling it. And where, so point one more time for me, where you're...
right here, or like here, like kind of on this side of the muscle. Do you know what I mean?
Okay. So there's couple divisions of that muscle, and I'm feeling right in that centerpiece of where she's pointing to, so I can see, yeah, and I feel some ropiness right through there. I want to feel that other one for reference. Nothing there. And that right there. And as we trace that, that's actually worse as I go up.
That's exactly like...
Yeah, right there. So that right there. Yeah. So this is a classic, what we call like just a sprain strain injury. So something where a sprain refers to more of the passive, so the joint being injured. And Natasha, what that means is that actually that hip bone itself where we were, that where we adjusted. But then the strain refers to the muscle. So you actually, that hamstring muscle, you did strain. And right there, as we move up to where it inserts right on their sit bone. So we're gonna be right up where it inserts. And it's worse as I move up. I don't know if you feel that. Yeah. So that's probably the most tender point of all.
Yeah.
Right there, I'm gonna put pressure on it, and I'm gonna move toward that insertion as I shorten the muscle, and then I'm just gonna lengthen it out like that. And then as we have her move again through this after, should feel better. There we go. Okay, good. Let's have you stand for me one more time, and we're gonna do that same motion that we went through as we have you forward.
Oh, it feels like so much looser.
Good, yeah. So now that's where addressing both bone and muscle comes into play. Now we've done that. We're gonna adjust the rest of your spine now.
Okay.
So let's have you go face down for me one more time, please. So feeling for motion of her spine. We've been working together for a while now, so knowing where her spots are that we've been working on, but still every time things are adapting and changing, so it's different. Right there between your shoulder blades. Big breath in for me, please. Let it all go. And let it push there. There. Good. You all knotted up that was too.
Yeah.
I didn't want to move with just a little bit of pressure, so the more that second time. And good, just breathe through here. I want you to expand your ribs as you breathe, and we're just gonna let that area move. Good, it should feel easier to move. Yeah, that's what we want. And then we're gonna feel, and this is usually the hot spot for you, is right around that neck area. There. Yeah. And right there.
I feel that.
Yeah. So with this, we're gonna do it a little different this time. Let's have you turn over onto your back. Okay. So with the left hand, I'll have you grab the back of your neck on that same side. Good. Now I'm actually gonna be on that side. And then with this hand, we'll keep it right here. I'm gonna put my hand right over yours.
Okay.
And we're gonna be on the upper ribs here. Big breath in for me, please. Good, let it all go. Yeah, it is stuck, so we're feeling those ribs glide. We're gonna have you do this one here, and then all the hair. Okay, I'm gonna put my hands right over yours.
Okay.
And then there, squeeze your elbows together, and lean you back. Look up for me. There we go. Good. So good, that's the movement we wanted. And with that, for people watching out there, I'm actually vectoring that here with my sternum, right along her spine to get that right angle. So it's not just looking for a noise, but really wanting that specific spot to move. So let's have you go face down one more time. I mean, to feel the upper back. Yeah, so much better there. So we're gonna use this. It's just a instrument that we're using to adjust her neck. With some people, I always like a cracking or a popping or a twisting. What was your experience? You were one that you prefer something else?
I like it, but I also was like, I don't know. It's kind of I like this though.
She likes this. So with the first thing I'm going to do is palpate the muscles along the sides of the neck. And let's have you look down for me, please. And that helps them stand out more. And on the right side, all the way up the neck, that muscle's really ropey. And I'm going to move you here this way, and we'll show the camera right up close on the neck here. And what I'm feeling for along the neck is just these muscles along the side. And right here on the right side, you feel that, Natasha?
Yeah.
How does it feel to you?
It feels like almost, I don't know, like a bruise. Like it's hurt. It's like tension and like a sore muscle.
There's a lot of tension there, yeah. So with you, it's been a couple different things that we've been working on in the neck, but the main one has been that top bone. It's called the atlas, and that right side there, where my hand is. So at the top. And this bone I'm about to make an adjustment to so many times is a source of jaw problems, jaw tension.
Oh yeah, I have a clicking jaw. Does that have to do something?
There we go.
Like my mom told me to ask you.
Well, good thing I mentioned it.
Yes.
And you can tell your mom that you had asked me now too.
Okay.
So we'll look at the jaw too here afterward. Let's actually see the jaw open first and then close. I can feel it click too. So it's your problem is your jaw's too mobile actually on that right side. So it means more homework.
Okay.
We got exercises to do to create stability. If it's too mobile, if you've seen our other videos, we don't adjust it. We stabilize it through exercise. If it's stuck and not moving, then we'll move it. But a lot of this for you is the neck. When we stabilize your neck, your jaw tension is gonna minimize or go away. And there on right side. So this is really specific on this bone. We know how it's moved, and I gotta get that angle right. Here we go. And what does that feel like for the people watching?
Feels like a spring, just like a spring on you.
Just hitting you, right?
Yeah.
And describe the difference for me now. I'm laughing over here a little bit because I can feel the difference.
Yeah. Like,
let's let you talk.
No, there's literally like a rubber band that doesn't have tension anymore.
The tension's gone, yes,
Feels
completely.
good.
So let's have you look down one more time, and I'm just gonna refeel the muscles. And as I move my hand back and forth, there's no tight muscles at all in the neck. So again, a muscle pulls tight for a couple reasons to try to splint or guard a joint that has a problem with it, which is going on there, and also to help try to pull the bone back into the right position. So when we do that, when we correct one of these joints, the muscles calm down. So, but sometimes, like we saw, we got to do a little muscle work, like on the hamstrings. So stop hurting yourself.
And what were some of the things you were originally coming in for?
Came in, it all started with my left hip, just kind of feeling like it needed to be popped into place, but I could never get to it. Then I started having troubles with my shoulder, feeling tight and having some pain there, especially during my workouts, and some knee tightness and a lot of swelling in that knee. So just kind of left-sided.
How are we doing?
Way better.
Way better, good.
So much better, yeah. I'm able to work out now, do the workouts I wanted to do and finish them completely without pain.
Yes.
I'm able to go heavier, so that's been amazing. The knee hasn't swelled up, the shoulder hasn't hurt, the hips been perfect, so.
I love it!
Yeah.
And then I would assume that translates even at work, maybe just a little more comfortable being on your feet with how long you are.
Yeah, I've noticed at work, after the 12, 13-hour shifts, I would come home tired, which is to be expected, but a lot of back pain, and I just related it to keeping the stress in the back and stuff, but it's really things that accumulate, so me not being aligned properly contributes to that. So it wasn't normal, but I was thinking it was. So I just feel lighter. So
how many people can relate to that, for sure. Cool. And then we haven't done an updated posture picture. So that's another thing we always do with all our patients. The very first day, we do a posture picture to see where we're at, and we do that again down the line, roughly a month out each time, to see how it's corrected. But without further ado, let's have you go face down, and let's check in on everything, okay?
Alrighty.
Cool. So checking in with the hips, left side versus right side. And it's the right side we've been adjusting. That's another cool thing to mention, because it's a lot of left things going on for you, right? And sometimes, absolutely, yes, it's where we feel it. But sometimes with the hip, there's really not a left or right side yet. Sure there is, but functionally the hips are the hips. Okay, so if we change the right side, we're changing the left side. So we've been adjusting the right side, and the reason for that is because that's the side not moving so much, and the left side is moving extra, thereby causing too much motion, thereby causing pain. So we'll be adjusting her right hip today. So we'll have you lay on your left side facing me this way, please. Cool, and then just a little shuffle toward me. Good. I'm gonna bend the leg here. I'm gonna put that arm on that elbow. Cool. Good. And then back to face down, please. Good. Did Siri just say that adjustment was good?
Yeah.
Yo! Cool. So a bit of mid back here. Right there. And go ahead and let your arms kind of glide forward a bit more. Yeah, there you go. Nice breath in. And out. Let that go. And then go ahead and flip over on your back when you're ready, face up. How was that? That was a big one.
Yeah.
Man, we're saving that for YouTube. I like it. Cool. And then we'll have your body kind of come over this way just a little bit. Good. Straighten you up on the table just a bit. We'll be doing a neck adjustment here though. Checking in with the neck. Cool. Checking for motion here. Alright, so one right there. Good. Let that head relax like it's laying on a pillow. Breathing in and out. Good. Okay. Checking back in here. Last one here. And this, guys, for anyone who cares, because some of you guys are paying attention to what segments we're adjusting. This is C2, the second vertebrae down in the neck. Good. First one was me, second one was her. Good. Cool, so let's go ahead and have you stand up. Or actually, we'll have you sit. I want to double check in on that shoulder. So I'll have you sit. You'll be facing off to the right, facing that way. Let me check in with the shoulder here. So when it comes to the shoulder, it's such a complex joint. There's so many things to check, not just here. The shoulder is connected by way of the collarbone. So we'll always check the collarbone. Something popping up as a shoulder might actually be a collarbone. And also, you guys know the shoulder blade is connected to the shoulder, and it's where the shoulder actually sits in the shoulder blade. Okay, so the shoulder blade's not having a easy enough time gliding across the ribs here. Sometimes by adjusting this, we'll free up the shoulder. And that's pretty much what we've been doing for Yvonne most of the time, is a lot of this rib work here, because there's some tension here too, with tight muscles. So we'll have you just rotate your body to the right a bit, and then we'll grab out this guy, the activator, and we'll be running up the heads of the ribs, helping all those ribs glide around. So here we go. Good, and back to center. Doesn't feel like that's maybe doing a whole lot, but do you feel that doing something?
Yeah, it feels good towards up top.
Good, good. And then we're good there. We'll have your left hand rest on this right shoulder. I'm gonna be sitting right here. So same idea here, the ribs, we're just helping them glide around from a different angle. Those same ribs, not always everyone's favorite adjustment. So just a couple here. Good, you do good with it though. Oh, you are a little ticklish. Uh-oh, 2 more. Last one, good. Good. Stand up, move around a little bit, and then let's take that new posture picture. Cool? Cool. So we'll have you stand over here. You'll be facing that way. I'm gonna sneak by you real quick. And then we will take the picture here. So from the front, just lining that up, not making your posture better or worse, whatever feels natural to you. Yep. Cool. And turn your whole body to the left for me, please. Good. Perfect. So hips, knees, and ankles, guys. We're looking for a straight line from our ear, shoulder, hips, knees, and ankles. The further forward we are, that's going to cause a lot of tension on the back. And if we go forward and then come back, it's usually those points that we're feeling so much compression. So a lot of people here at the hips will feel it. For you, we're looking nice and straight. Green is ideal. Red is tracing you. Okay. So here's the cool part. It's like, hey, was that better or worse than the first time? Who knows? Well, I know because I still got it from the first time. So you came in January 5th. Mm-hmm. Today is February 11th. January 5th, February 11th. So 5 weeks. We're going to throw those into a side-by-side comparison.
Oh, that's cool.
It's cool, right? Cool. So we can see from the first, oh man, check that out. From the first time you came in, okay, all your problems were on the left. Mm-hmm. Your left shoulder was higher and you were leaning away from the hip and knee because it wouldn't make sense to put weight into where you're hurting. So you're leaning away from the pain as most people do. And you could see that because your head was literally on that side of center. Mm-hmm. Check that out today. Wow. Huge difference in 5 weeks. But you used to have daily headaches on the reg, and you've had none to few?
Yeah.
Huge
improvement.
5 weeks later,
yeah.
And we still got changes to make
yeah.
because hypothetically, like walk away from this and be like, well, I'm fixed, like I'm good. True, but if we just like never saw you again, this would be something that creeps back. Mm-hmm. So I'm still recommending to see Yvonne, but now we're at such a less frequency than what we were. Now we're transitioning towards this maintenance where she comes in every once in a while, not because she's in pain, because she's feeling good and she wants to keep feeling good, right?
Hey guys, Dr. Matt from Lifespring Chiropractic. We're here today with Stacy, and Stacy has got a laundry list full of stuff. So what's going on, Stacy?
Literally a whole page. I had a lot of injuries as a kid and then growing up as an athlete. Dislocated a lot of my major joints, car accident and surgeries on my knee and foot. So not really maintaining proper care over time, and also being from a small town, not really having any proper posture monitoring, just kind of accumulated a lot of different injuries.
And we talked about in sports too, right? A lot of times it's the shake it off mentality. I think that gets so many of us in trouble. So we did a full assessment off camera here. I'm going to show the highlights here and the adjustments as we get going. So one thing we mentioned was hypermobile or too mobile in some of the joints, right? And it's showing up on motion. So I'll have you real quick too, just so the camera can see. Looking down all the way as far as you can. Good, and then up all the way as high as you can. Yeah, so there's where we really see that hypermobility, and that nose gets all the way flat the floor, and then same with the ear to shoulder, good to both sides, and that same thing. So seeing that's too mobile in my mind. So most of the time it'll be too mobile through the mid neck, but something stuck either in the upper back or at the very top of the neck, and that's exactly what we found with you through our full assessment. But motion's one of the tools, posture another that we looked at today, and then muscle tests also. So we're going to show some muscle tests down low. We'll start with the low back and work our way up. So let's have you start face down for these. And you've seen other chiropractors and just recently too, right?
Yes, frequently. I've seen it a lot.
Yeah, and this is another common thing that we find, but it's not always maybe the right spots, or maybe it's not the specific thing for us. So many times we'll see people that have been to other doctors, other chiropractors, PTs. You've been to the PT, yes?
Yep.
Okay.
A few different ones.
Okay, so
they don't dig deep enough.
So there we go. Was this a little different than what you've had?
Yes, much more thorough examination.
Okay, cool. So we're gonna look at the glute muscle test first. We'll start with the left side. Stacy, I'll have you hold here. I'm gonna push in, don't let me. Okay, with this one I'm gonna push in, don't let me. So
I can't believe how difficult that is.
So that right when you feel it's not working at all, and for the people watching at home, I'm pushing the same strength on each side, but would you agree there's hardly anything in that right?
Yeah.
And this left one I'm going to push straight down, don't let me. Okay, and not great there. We're going to push straight down, don't let me. And nothing there. And that's, so the glute medius and glute max on the right side. Don't worry, we'll let you redeem yourself. And then feeling for motion here, we're seeing if the joint moves correctly, and if it doesn't, then over time it'll become painful. And that's right there, Stacy, with that right side. It's not moved. And I was showing her off camera here, it's the sacrum that's not moving, that's stuck. And that's what we're gonna get moving today. And then here in the mid back, right there, that one as well. And what I'm feeling for this muscle tension on the right side is really ropey even there. So that's something we want to see go away. And then at the very, very top, that's the atlas. And we found that right side of the atlas. And when we side bend the neck from side to side, when we're finding one's not moving as much, that's where I'm really looking at. So we'll start with the adjustments here, and then we'll re-show some of these muscle tests. Let's start you on your side, facing me this way, please. And I'm gonna bend that, there we go. She knows, it's like I've been adjusted before. And you said last time was a couple weeks since you
last week.
Oh, last week, okay.
Yeah.
So I'm gonna roll you toward me here. And I'm gonna pin your hips down and a little push there. A little more. There we go, good.
Got it.
And then let's have you go face down for me, please. So I want to recheck those. Now's your chance to redeem yourself. So we're going to start with that left again. Hold out here for me, please. So good, that left stronger too. I don't know if you feel that, even though you're on that right side. So hold here. Yeah.
Oh my gosh.
And then I'm going to bend the knee. Let's bring that up. I'm going to push down, don't let me. One more time, hold. A lot stronger. Not perfect, but a lot stronger. Would you agree?
Yes.
Move your out of the way here.
Yeah.
So right there. Big breath in for me, please. Good, and let it all go. Good, and that's really stuck. And we've got the ribs that are involved there too, right there. Where I'm pushing, that's the rib cage. So you're gonna feel your chest pop up from underneath you. And then just very lightly, you're gonna feel this drop. You okay with that? Okay. There, that's better. And then another rib right above it. And what I'm feeling for those, the ribs are getting stuck along that scapula, so that shoulder. If that shoulder is not moving or tracking correctly, many times, that'll be why, right there.
The ribs.
The ribs, yeah. Go figure. But you had a car wreck, yes? And you didn't get any treatment after, correct?
Nothing.
Okay. So they have not healed correctly, so we got some work to do. Let's have you sit up for me, please. We're gonna do this next one seated.
Okay.
So this is the top bone in the neck. This is a spring-loaded instrument. I'll show you on your leg here so you can feel what it's like. It's gonna be on your neck, on the top bone on the right side. So head down for me, please. Do you notice that? Where I'm touching?
It's really tight.
Yes, exactly. I wanted you to say mostly on the right side, yeah? So you feel the difference more than the left. Now let's have you look straight ahead. And as we make an adjustment there. Good. And then head down one more time for me, please. What do you notice?
Looser.
Yeah. Does that feel
Wait, that was
too?
an adjustment?
Yes.
Oh, wow.
So we're so used to an adjustment being like a pop
Very
or
dramatic.
crack. Yeah. So you just experience that difference. Does it feel different when you move it too? So motion changes immediately. Muscle tone changes immediately. The position of the bone changes immediately. That's when adjustment takes place. We're so used to seeing or hearing like a crack or a pop, but it doesn't have to be. Let's have you lie on your back for me, please. We're gonna check. So with the left knee, you had, it was an ACL and a meniscus.
ACL and meniscus twice. ACL was fully replaced and meniscus was
So these are
reconstructed
major
twice.
surgeries on the left knee, fully replaced. And I want to show the highlights of a couple of the weak points here. So let's have the toes out toward me, and then I'm gonna push the leg down, don't let me. And that's, again, the patchy is how I would describe it.
Yeah.
It's like the strength is there, it's not, it's there, it's not. And we want it to be consistently able to hold, and it's not. And you had felt that, you told me before.
Yep.
Were you feeling that again still on that
Yeah.
inside part? So go ahead and relax that leg for me, please. And when I examined the full knee, I'm shortcutting it here on video, but we looked at everything structurally first. So when I pressed in all directions on your knee, making sure the ligaments are still intact, they're strong, they're holding. So it's good to be adjusted, but even then, I'm not going to hammer it. It's going to be light, because again, an adjustment can happen either that quick, what you've seen before, or light.
Okay.
This is a light one.
Okay.
So
I've never had my knees adjusted, so this is really interesting.
So this is a drop piece. You've had it, I think, on your pelvis you were describing to me. It's going to pop up and then drop down like that. Okay. But it's for the knee, so let's have your knee here. And then right there. Is that all right?
Yeah.
Almost feels like nothing, right? Anything? Yeah, exactly. That's what we want. A little more there. Okay. And that should feel different.
It's not as tender, actually.
That's what we want. You look confused.
I didn't know that was possible.
And then toes out toward me, please. And then same thing, I'm going to push it down. You feel the difference.
Oh my gosh.
Yeah. So I can feel it. You can feel it. I'll let you describe it.
I seriously thought I was just going to be in that amount of pain forever because of how many surgeries I've had on that knee.
And at the end here, we'll have you walk on it too, which is really cool, because when you stand on it, it's going to feel completely different and more supported underneath you. But there's more to be done. And you've had multiple ankle injuries on both sides and a surgery on the right foot, correct?
Yeah, so the hypermobile joints is, I think, the reason I roll my ankles so much. But then I had this joint here, the big toe joint, kept dislocating in my sleep, where I'd wake up in the middle of the night and this toe was like pointed down. So surgeons screwed these bones together, which I think now is hurting my ankle even more. But I haven't had as many issues there, but...
So what happens when anything's glued together, either by choice from surgery or from the body, if it's degenerated enough, is it will become typically more painful over time. But in certain times, we want to do that to try to stabilize it more, like this, to stop dislocating. But because of that, when I was feeling your foot off camera, I mentioned here that little bit of swelling, and it's not moving as well on that right foot. So absolutely, I think that from this, it totally has affected the mobility of your ankle. So first motion, what sports did you play?
Volleyball, softball, track, basketball.
Volleyball and basketball were the...
And gymnastics was the most injuries.
So there we go. And those three are huge for ankle rolls, little ankle sprains. A lot of times people say, well, I never had an injury because it wasn't formally diagnosed. Or right, the coach would just say, shake it off, keep playing.
Right.
But it's still an injury, so they add up. Yeah. You said it well, that accumulation of all the little things, and they add up. So here, that first one on the outside is the cuboid. I'm going to pull toward me here. There we go. And again, for not all of you, Stacy, you'll hear a noise, but we'll feel that joint move, and that's what happened a little bit here. There we go. Wow. And then heel also. And that's what's really stuck, was that heel. Now, I'm not going to be on that joint that was fused together. Obviously, I'm not going to try to break apart a fusion.
Oh, good. Thank you.
But we're going to free up all the neighboring joints around it that are taking more pressure or more stress. And with this, I'm going to use a light force technique also. You haven't seen yet. How many tools does this guy have? This now, it's a little different than the one we used on your neck. It was like that. Okay. Super light.
Pretty crazy that I never did physical therapy on my foot.
I know.
Surgery.
I know, I'd say so too. And then the middle of the foot here, this is where, it's these joints almost feel fused, Stacy, because they've been
so tight.
Yeah, they just haven't moved so long. And then a little more on the heel. There we go. And this one should move a lot different. Yeah. So on the outside there. You're out different it sounds even too. And that's the sign of a more healthy joint that sounds like that. And that too. And one more on top. Good. And then on the outside there. Okay. Good. And let's have you take a few steps so we're all through. I want you to feel the difference as you walk around and move a little bit and see maybe how different that feels. What do you notice as you walk?
I don't feel anything in my knee, which is weird.
In a good way.
How long? I feel kind of like light, like floaty.
Good. How long has the knee been like that?
Oh my gosh.
that you had been feeling it
Let's
before?
see.
And we have a list. We literally have a list. I'm gonna peek at this list.
I want to say like 10 years.
So 2007 was the left
Longer,
knee
13
dislocation
years.
and the ACL. Yeah, so it's been years.
I'm trying to do a squat.
Yeah, and does that feel different?
I feel like so much stronger, and actually my glutes are like, I know I work out, I know I'm strong, but they're like, they're useful, yes.
That's because if we're using them and they're not working.
I don't feel that in my hips either when I squat.